Hello friends, this is Vishal. Welcome back to the second part of our learning video. We are studying Chapter 7 Allergy for Grade 7 Biology. Today we are going to start with some common allergic reactions. The first one that we are going to deal with here is known as hay fever. Let's go through the text. Hay fever is usually caused by a reaction to pollen and is therefore particularly common when flowers are open. Many people suffer from it. The lining of the nasal cavity becomes sensitive and inflamed and produces a large amount of mucus. So the affected person suffers from running nose and sneezing. The eyes may be affected in the same way. It becomes itchy, sore, and weepy. When a person reacts adversely to a substance in this way, we say he is allergic to it. So hay fever, we can say, is mainly due to pollen, and pollen acts as an allergen here, and in the presence of this allergen, people who are allergic or have hay fever, they will suffer as the lining of the nasal cavity will become sensitive and inflamed. Then a lot of mucus or cough will be produced. Person will be suffering from running nose and sneezing, and the eyes will also show the effect of the allergy. It will become itchy and watery and sore, and it is very easy to identify such a person who is undergoing the allergic reaction. And so the first one that we have come across is known as hay fever. Alright, now since it's done by pollen, we can say it's seasonal, because pollens will be when flowers are blooming, and flowers bloom seasonally. So yes, let's go forward with the next one, that is asthma. Now it is more serious. Asthma is a serious allergic condition. The muscles in the wall of the bronchioles contract, so the tubes get narrower. This makes it difficult for a person to breathe, because of which he or she wheezes. Wheezes means a sound that comes from the chest because a person has difficulty in breathing. The attacks are often brought on by pollen or dust or any kind of allergen or any condition that a person is allergic to. And to explain this further, I have attached a video. Please enjoy the video while you're learning.
Asthma is a lung disease that inflames and narrows your airways. Normally, as you inhale, air moves freely through your trachea or windpipe, then through large tubes called bronchi, smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your bronchioles expand when the air is warm, moist, and free of irritants and allergy-causing substances called allergens. When air is cold or dry or contains irritants or allergens, your bronchioles contract. If you have asthma, your airways are frequently inflamed and swollen. Certain substances can cause your inflamed airways to overreact even more, resulting in an asthma attack. Triggers of asthma attacks are slightly different for everyone, but usually include outdoor irritants and allergens, such as pollen, smoke, pollution, and cold weather. Indoor irritants and allergens, such as mold, pet dander, dust mites, and cockroach droppings. Food allergens, such as fish, shellfish, eggs, peanuts, and soy. and conditions such as respiratory infections, stress, strong emotions, and exercise. The symptoms of an asthma attack include coughing, wheezing, shortness of breath, and tightness in your chest. During an asthma attack, also known as a bronchospasm, the muscles around your airways tighten, and the airway wall becomes more swollen. Your airways also produce thick mucus that narrows them even more, making it hard for you to breathe. If you have asthma, your doctor may prescribe medications to reduce inflammation in your airways, constriction of the muscles surrounding your airways, or mucus secretion in your airways. During an asthma attack, you may need to use a short-acting rescue medication called a bronchodilator. This medication causes your airway muscles to relax quickly and provides symptom relief within minutes. Since there is no cure for asthma, the goal is to prevent you from having asthma attacks by using long-acting anti-inflammatory control medications. If you take them every day, they will reduce the inflammation of your airways, making them less sensitive to triggers of asthma attacks.
Hives are an intensely itchy rash, generally raised and red, that comes and goes over time. And you can have acute hives where hives will come for a few hours and then go away and not come back, or chronic hives, which by definition are daily or almost daily for at least 6 weeks, and sometimes up to years even. Hives they're generally red, raised, itchy, and they can be pinpoint or more commonly look like a welt, sort of more like a mosquito bite appearance. And they should not leave behind a mark or a bruise. If a hive is leaving behind a mark, then that's something to mention to a physician. Acute hives, which generally come or go within a day or a few days, are most commonly a result of an allergic exposure. And so generally the most important thing will be the clinical history. So the questions we ask and the clues that a patient gives us helps us determine what might have caused the hives as part of an allergic reaction. Chronic hives, on the other hand, which generally last for 6 weeks or longer, don't usually have a secondary cause. But we will do some basic testing just to rule out anything serious as a secondary cause for the hives. Mainstay of hive treatment is going to be oral antihistamines, some of which are available over the counter and some of which are by prescription. There are 2 different kinds of antihistamines. So there's going to be the short-acting, more potent antihistamine, which is oftentimes the one that makes you very drowsy, so it has more side effects. And then the longer-acting antihistamine that stays in your system longer, may not be quite as potent, but can have more of an effect for longer. If antihistamines are not enough, then generally I would talk to a physician about other options, and we have many immunomodulators and immune suppressants that can calm the immune system so that that revved up immune system causing the hives can be more calm. In addition, if we find an acute cause for the hives, then we'll generally advise avoidance.
Welcome back, friends. I am sure you must have enjoyed the video of asthma and the hives that we studied. And the text in our book about hives mentions, hives is an outbreak of swollen pale red bumps or patches on the skin that appear suddenly due to an allergic reaction to certain allergens like medicine or food. And we can see here how the skin has got these red patches and how its allergic reaction is visible here. And I'm sure the video before must have made it very clear as well. Now we go to anaphylaxis. The anaphylaxis can be a dangerous situation because in a very short time a huge magnitude of allergic reaction is seen. So we call it anaphylaxis is a sudden allergic reaction resulting in decreased blood pressure and shortness of breath. The nature of anaphylaxis is such that the reaction can seem to be subsiding but may reoccur throughout a period of time. So we find that a sudden allergic reaction is known as anaphylaxis. So this can be a dangerous condition. People should be taking precaution. They should be alert, vigilant, and should inform people around them, their friends, that if they have such allergic reactions, to help them when they are suffering with such a allergic condition. Now, till now, what we have done, as in our syllabus, we have hay fever, we have done asthma, we have covered hives, we have covered anaphylaxis. Now we are going to go with the next portion, which is precautions to avoid allergic reaction. Well, this is interesting because we all would like to know about it. So let's go through it. There is no permanent cure for an allergy. Oh no, that's painful. So there is no permanent cure for an allergy. Medication for allergies do give relief. Okay, so there are medicines that can give a person relief in allergic conditions. Those people prone to allergic reaction should be aware of the allergens that trigger these responses. So people who are prone means people who get allergy every now and then. So they should be aware that yes, I am a person who gets allergy, and the things that give me allergy, like the allergens, if you're aware of that, your life can be much easy. Because if I know I'm allergic to milk products, and what I can do is I can easily ensure that I am avoiding those products that give me allergy, and I can save myself from an allergic condition. Okay, as it's given there, avoid them completely, avoid the allergens, especially food and medicine. Now, anti-allergy shots are helpful to those with seasonal allergies, like those caused by pollen. So anti-allergy shots are like injections that are given to people who have seasonal allergies, so that their bodies will not respond to the allergens, and they can save themselves from the allergic condition. They can get relief. Now, doctors specialized in treating allergies should be consulted when the allergy is severe. So we should just not sit at home and suffer when we are having any kind of allergy, or we come to know if someone is facing an allergic reaction or a condition, a doctor should be visited and treatment should be taken. Now, diagnosis of allergy. Diagnosis means to find out. With the help of symptoms, we try to find out what exactly has happened. So diagnosis is all about finding out. With the help of these symptoms, we try to find out what exactly has happened, so that once people know what exactly has happened, then only a proper cure for it can be advised by the doctor. So diagnosis of allergy, to find out what allergy you have and what is causing allergy. So diagnosis of allergy deals with that. Now let's have a look here. Effective management of an allergic disease relies on the ability to make an accurate diagnosis, find out clearly the facts related to the allergy. Now, allergy testing can help confirm or rule out allergies. Correct diagnosis, counseling, and avoidance advice based on valid allergy tests results reduces the incidence of symptoms and need for medication, and improves quality of life. So if you are able to find out what exactly is the problem, what's the cause of the problem, and then you can take counseling and proper advice, and if required certain medicines in time, it can improve the quality of your life, because you will feel relieved and you'll be able to avoid any allergic condition. To access the presence of allergen specific antibodies, two different methods are used. So there are two kinds of tests that are used. One is known as the skin prick test or an allergy blood test. So there are two tests. One is the skin prick test and the other test is known as the allergy blood test. So skin test and blood test are two different tests that are done to find out about allergies. Both methods are equally valid and are recommended for diagnosis. Now let's have a look at the first method here, the skin prick test. Now as we know, skin, that's not a problem. Prick means something that pierces the skin, like piercing of a needle is known as prick. So skin prick test. Now skin prick test is also known as puncture test. Puncture, again, you know, when as you know with your tires what happens, When a nail is pierced in the tire, it's called as a puncture. A hole is dug there, small little. So puncture, that means in the skin we are going to prick something. We are going to poke something in the skin here in this test, or known as prick testing. Due to the series of tiny punctures or pricks made into the patient's skin. Okay. A small plastic or metal device is used to puncture or prick the skin. So there are small pokes made by a metallic device like a needle or a plastic, a sharp edge to make certain punctures or prick the skin. Sometimes the allergens are injected intradermally into the patient's skin, sometimes inside the skin only. Intradermal means inside the skin, not deep, only skin deep. An injection is done of allergens directly into the patient's skin with the help of a needle or a syringe. Some amount of suspended allergens or their extracts like pollen grains, insect sting protein, peanut extracts are introduced to the site on the skin marked with pen or dye. Let's have a look. Areas for testing include the inside of the forearm or the back. So the inside of the forearm or the back is used for testing. There will be various holes or small punctures done on various places of the forearm or the back, and on each there will be the allergen will be placed so that the allergen can go inside skin deep. And once the allergen goes skin deep, if you are allergic to that particular item, you will show a certain symptom of swelling or redness in that area. So let's have a look how it is mentioned here. If the patient is allergic to the substance, then a visible inflammatory reaction will usually occur in about 30 minutes. This response will range from slight redness of the skin to a full blown hive in more sensitive patients, similar to a mosquito bite. Some patients may believe they have determined their own allergic sensitivity. So we can see here how it works. This is the forearm, the inside of the forearm. Various pricks have been done, 1, 2, 3, 4, 5, and as you can see here, there are various pricks like dog, cat, dust, pollen. The pricks have been made here, and various allergens have been placed here, and we want to see whether this person is allergic to anything. A drop of a fluid containing the substance to be tested is placed on the skin. Then the skin is pricked through the drop. If the person is allergic to the substance, a blister develops. Blister, as you can see here, this person seems to be allergic to pollen. A blister has developed. This particular person was found to be allergic to certain kind of pollen, as the blister came for pollen here. What do you think the control drop consists of, and why is it included in the test? So they are asking you why the control drop is here, and why it was here, why it is included in the test. So what are your guesses? Yes, it is for comparison. With the control we can always come to know the comparison, that how much we can compare, that how much you are allergic to, what volumes you are allergic to, and what things you are allergic to, what are the allergens, and in which quantity you actually are allergic to. Anyway, so I hope by now you've been able to understand the skin prick test. Wasn't that difficult? Great. Now let's go ahead and have a look at the next one. The second kind of test is known as the blood testing. An allergy blood test is quick and simple, and can be ordered by a licensed healthcare provider, example an allergy specialist or a doctor. Unlike skin prick testing, a blood test can be performed irrespective of age, skin condition, medication, symptoms, disease activity, and pregnancy. So in any condition, if the person is, this blood test can take place, no problem. An allergy blood test is available through most laboratories so it is available mostly everywhere. A sample of patient's blood is sent to the lab for analysis. Multiple allergens can be detected with a simple blood sample. Allergy blood tests are very safe since the person is not exposed to any allergens during the test procedure. So in skin the person was exposed, whereas in blood the person is not exposed to the allergen, so this is much safer as mentioned here. The test measures the concentration of specific antibodies in the blood. The quantitative allergy blood results can help determine what a patient is allergic to and helps to predict and follow the disease development, estimate the risk of the severe reaction, and explain cross-reactivity. So with that we came to the end of the reading of this chapter and the understanding of this chapter, and now I am going to attach one video that will give you a summary of this chapter, and I hope you enjoyed the video. Please revisit part 1 and part 2 video for a complete understanding of this chapter, and thank you so much for watching this video attentively. God bless you.
Came into contact with the allergen. Anaphylaxis. Certain insects, medicinal products, and some foods may trigger all the above mentioned symptoms, aggravated by hypotension, vomiting, diarrhea, and cramps, which may be life-threatening. Diagnosis. The doctor will ask the patient questions regarding symptoms, when they occur, how often, and what seems to cause them. They will also ask the person with symptoms whether there is a family history of allergies, and if other household members have allergies. The doctor will either recommend some tests to find out which allergen is causing symptoms, or refer the patient to a specialist. Below are some examples of allergy tests. Blood test. This measures the level of IgE antibodies released by the immune system. This test is sometimes called the radioallergosorbent test, or RAST. Skin prick test. This is also known as puncture testing or prick testing. The skin is pricked with a small amount of a possible allergen. If the skin reacts and becomes itchy, red, and swollen, it may mean an allergy is present. Patch test. A patch test can identify eczema. Special metal discs with very small amounts of a suspected allergen are taped onto the individual's back. The doctor checks for a skin reaction 48 hours later, and then again after a couple of days. Treatment. There are many types of anti-allergy medications. The choice of medication and how it is given depends on the severity of the reaction. Long-lasting antihistamines. These medications are available over the counter. They are meant to be taken for months at a time, even indefinitely. Most can be taken once a day and last for 24 hours. Corticosteroids. Corticosteroids are usually given via IV at first for rapid reversal of the effects of the mediators. These drugs reduce swelling and many other symptoms of allergic reactions. It will probably be necessary to take an oral corticosteroid for several days after this. Decongestants can restore sinus drainage, relieving symptoms such as nasal congestion, swelling, runny nose, and sinus pain, or pain or pressure in the face, especially around the eyes. Allergy shots. These are given to some people who have persistent and disruptive allergy symptoms. The shots do not treat symptoms, but by altering the immune response, they prevent future reactions. This is referred to as immunotherapy. Probiotics. There have been studies that have looked into the use of probiotics, or live microorganisms thought to be beneficial to the body, to treat allergies, particularly atopic dermatitis in infants.